need to start doing is important to emphasize that adopting a system approach to error reduction in healthcare requires a shift from blaming the individuals, the physicians, the therapists, the nurses, for errors, and shifting that to analyzing the system and uncovering the design flaws in the system. If the system is designed properly, the healthcare professionals aren't put in a position where error is an option or error is minimized at least. And so I think that's the key to this is looking at it from a systems approach and designing in those checklists, those policies, procedures, to where error is not an option. And if you look at other industries, that's exactly what has been done. Error has been designed out using principles of human factors and ergonomics.
Okay, great. We have another question here from Ken who asks, do you advocate a quote-unquote policy as a prudent thing? It documents a pure standard of care versus the professional's training and judgment.
Matt, could you repeat that?
This question comes from Ken who asks, do you advocate a quote-unquote policy as a prudent thing? It documents a pure standard of care versus the professional's training and judgment.
Well, I think that any system, and we'll talk about this in a little bit, that and one of the reasons that you cannot directly take things from industry into the healthcare situation is that the human being has quite a bit of variability, and each situation does have some unique elements to it and needs to be interpreted, and decision